I think it's disgusting. I just wish I didn't touch them when I was 12. Because once you get hooked on them, it's hard to get off of them.
It was one of the worst contagious nightmares I've ever had in my life. And still to this day I'm haunted by cigarettes because I find it very hard to quit.
Well, I think the smoking culture is improving, but it's still there. When I first started 20 years ago, most staff and clients would be smoking. So I think moving forward, it has improved, but it's still common in mental health services.
It's basically the centre of their life for a lot of them. A lot of them have been smoking for a very long time and they don't know any differently than doing that. And I guess the community around them are smoking as well. So it's really hard for them to quit because when they want to quit, there's other people around them that are smoking as well. So it makes it really difficult.
I want to quit after every smoke, but every 5 minutes it is in my mind that I'm like I'm being possessed.
You really hate cigarettes now, don't you?
Yeah. I don't like them, full stop. At my house, I've got quit smoking stickers all over my house.
I often find in clinic rooms is a good way to start. We often do blood pressures and cardiometabolic screening with our clients, and one of the questions is smoking cigarettes. So that's a nice in. And once you start the conversation, it's very easy from then on.
I guess it's a matter of just making sure that you've built that rapport with them to begin with. You're not going to go into someone's house and attack them for their lifestyle choices. But if you've built that rapport with them, you're able to ask them, is this actually something that makes you happy? And by asking them those questions and opening up that conversation around why they've made that choice to smoke, they may actually become reflective within themselves and actually go, yeah, why am I doing this? And knowing that they're in a supported environment where there's people around them that aren't going to judge them for the choices that they've made, because it's no longer a choice, it's an addiction. And they need that support to be able to overcome that.
Laura is helping you give up cigarettes, isn't she?
Yes.
Tell me how that works.
Oh, she said every time you feel like you want to talk about it, she's there for that reason, about quitting smoking.
Well, my gym trainers and that, I ring them up or send them a message and say, I feel like I smoke. They said, no, think of your animals and come down here and spend time with us.
The conversation continues. Just today there was a client who came in, hasn't smoked now for 9 months, but will update me every time I see somebody about how they're going with the cigarettes. It was hard and it was difficult for the client to give up, and there was a number of times where she would say to me, I'm quitting smoking. And I said, that's good. When was your last cigarettes? And she goes, 6 minutes ago. But with this ongoing dialogue, I found it's a great... people update you. They're quite happy to update you and tell you how they're going with the cigarettes.
You don't realise it yourself, but maybe other people do, just how filthy the habit is and how dirty a smoke really is. I don't know how they can ever put them on the shelf.
I've got to put my mind to it and say, put my foot down and say, right, this is it, no more.
You're on the path to recovery for giving up cigarettes. Do you feel stronger? Do you feel better?
I am smiling deep within.